Welcome to the Medical Terminology Quiz Part 1. What is the correct meaning of angio? Options are mouth, water, lung, and vessel. Angio, short for angiography, is a medical imaging technique that allows healthcare professionals to visualize the blood vessels in the body. It involves the injection of a contrast dye into the blood vessels, followed by the use of X-rays or other imaging methods to create detailed images of the blood vessels. Angiography is commonly used to diagnose and evaluate conditions such as blockages, narrowing, or abnormalities in the blood vessels, including those in the heart, brain, and legs. It can also be used to guide certain treatments, such as the placement of stents or the administration of clot-dissolving medications. What is the root word for slow? Options are cyano, gastro, brady, and tachy. Brady, short for bradycardia, is a medical term used to describe a slower than normal heart rate. It refers to a resting heart rate of fewer than 60 beats per minute in adults. Bradycardia can be a result of various factors, including certain medications, heart diseases, electrolyte imbalances, or an underlying medical condition. While some individuals with bradycardia may not experience any symptoms, others may feel dizzy, fatigued, or faint. Treatment options for Brady may include addressing the underlying cause, medication adjustments, or in severe cases, the implantation of a pacemaker to regulate the heart rate. What is the prefix for above normal? Options are poly, hypo, hyper, and mega. The term hyper is a medical prefix that signifies an excessive or elevated state. It is commonly used in medical terminology to describe conditions or symptoms that are characterized by an increased or exaggerated response. For instance, hyperactivity refers to an abnormally high level of activity, while hyperthyroidism refers to an overactive thyroid gland. Overall, the prefix hyper in medical terms indicates an intensity or abundance beyond normal levels. What is the prefix for below? Options are trans, semi, hypo, and post. The term hypo is a medical prefix that denotes a deficiency or below normal levels of a particular substance or condition in the body. It is commonly used to describe conditions such as hypoglycemia, low blood sugar, hypothyroidism, underactive thyroid, or hypertension, low blood pressure. These conditions can have various symptoms and may require medical intervention to restore the normal levels of the affected substance or condition in the body. What is the correct suffix for movement? Options are pnea, osis, algia, and taxis. Taxis is a medical term that refers to a specific technique used to manipulate or reposition a displaced organ or body part back into its normal position. This technique is often performed by medical professionals, such as chiropractors or orthopedic specialists, and is commonly used to treat conditions like dislocated joints, hernias, or other types of organ or tissue displacement. The goal of taxis is to restore proper alignment and function, thereby alleviating pain and improving the overall health and well-being of the patient. The suffix ectomy refers to. Options are condition, incision, paralysis, and growth. The term ectomy is a common medical suffix used to indicate the surgical removal or excision of a specific organ or part of the body. It is derived from the Greek word ektome, meaning cutting out. For example, appendectomy refers to the removal of the appendix, tonsillectomy is the removal of the tonsils, and mastectomy is the removal of the breast tissue. The use of the ectomy suffix helps to precisely describe the type of surgical procedure being performed. Febrile refers to options are mouth, fever, stomach, and blue. The term febrile is not a recognized medical term in the field of medicine. It is possible that it may be a misspelling or a misinterpretation of another term. It is important to consult a healthcare professional or medical dictionary to accurately identify and understand the correct medical term being referred to. Skin is the meaning of what root word? Options are derm, oro, myo and cyano. The term derm is a medical abbreviation that refers to the field of dermatology, which focuses on the diagnosis, treatment, and prevention of skin disorders. Dermatologists are medical professionals who specialize in managing conditions such as acne, eczema, psoriasis, skin cancer, and other dermatological conditions. They employ various techniques and treatments, including medication, surgery, and cosmetic procedures, to improve the health and appearance of the skin. Dermatology plays a crucial role in promoting overall skin health and addressing both medical and aesthetic concerns. A blue discoloration of the skin. Options are cilium, effusion, edema, and cyanosis. Cyanosis is a medical condition characterized by a bluish discoloration of the skin, lips, and nails due to a lack of oxygen in the blood. It occurs when there is a decreased amount of oxygenated hemoglobin in the bloodstream, resulting in a higher concentration of deoxygenated hemoglobin. Cyanosis can be caused by various underlying health conditions such as lung diseases, heart defects, circulation problems, or exposure to cold temperatures. It is important to seek medical attention if cyanosis is present, as it may indicate a serious underlying health issue. A prefix is a, found in all medical terms. B, the last part of the word c, the middle of the word d, found at the beginning and modifies the root. In medical terminology, a prefix is a word element that is added to the beginning of a word to modify or enhance its meaning. The prefix provides additional information about the nature, location, time, or quantity of the medical term. It helps to create more precise and specific medical terms, allowing healthcare professionals to better understand and communicate about various medical conditions, procedures, and treatments. Some common medical prefixes include hyper, meaning excessive or above normal, hypo, meaning below normal, pre, meaning before, and post, meaning after. By understanding and using prefixes, medical professionals can effectively convey important information about medical terms in a concise and standardized manner. What is the suffix for inflammation? Option A, tomi, option B, itis, option C, scope, and option D, osis. Inflammation, also known as itis, refers to the body's natural response to injury or infection. It is a complex process that involves the activation of the immune system to protect and heal the affected area. Inflammation can be acute, which is short-term and typically resolves on its own, or chronic, which persists for a longer period of time and may contribute to various diseases. Common signs of inflammation include redness, swelling, heat, and pain. While inflammation is a vital defense mechanism, excessive or prolonged inflammation can be harmful to the body and may require medical intervention to manage. Which suffix best describes breathing? A. Taxis, B. Trophy, C. Pnea, and D. Ectomy. Pnea is a medical term that is commonly used as a suffix in various medical conditions related to breathing or respiration. It is derived from the Greek word pneuma, which means breath or breathing. When combined with other medical terms, such as apnea, temporary cessation of breathing, or dyspnea, difficulty in breathing, pnea helps describe different respiratory disorders or symptoms. Overall, the inclusion of pnea in medical terminology helps healthcare professionals identify and categorize conditions associated with breathing difficulties or abnormalities. What is the correct meaning to the suffix osis? A. Movement, B. Paralysis, C. Pain, and D. Condition. Osis is a medical term commonly used as a suffix to describe a condition or a state of abnormality in the body. It is derived from the Greek word meaning condition or disease. Examples of medical terms using osis include osteoporosis, a condition characterized by weak and brittle bones, hypertension, high blood pressure, and gastritis, inflammation of the stomach lining. The use of OSIS helps healthcare professionals communicate specific medical conditions and abnormalities in a concise and standardized manner. What is the correct meaning for the suffix tomi? Option A. Incision. Option B. Observe. Option C. Surgical removal. And option D. Movement. Tomi is a suffix commonly used in medical terminology that refers to a surgical procedure involving the cutting or incision of a specific body part or organ. This procedure can be diagnostic, therapeutic, or exploratory, depending on the underlying medical condition being treated. Tomi procedures are typically performed by trained surgeons and may involve the use of specialized instruments and techniques to ensure precision and minimize potential risks. Examples of common tomi procedures include appendectomy, removal of the appendix, cholecystectomy, removal of the gallbladder, and hysterectomy, removal of the uterus. What is the root word for female reproductive organs? Option A. Gyne. Option B. GNY. Option C. YNG. And option D. NYG.